Transference and countertransference are almost always present at some level in counseling. The greater the number of hours engaged in a one-on-one situation, the greater probability that transference and countertransference will occur. Transference has been defined as a psychological bond between people in which one person's reactions in a current relationship is influenced by his former relationship patterns to significant persons rather than by the stimuli present in the context of the current relationship. This reaction is limited to the unrealistic, inappropriate, unearned roles or identities unconsciously ascribed to the pastoral counselor. Transference usually occurs in association with regression, and it presents new interpersonal manifestations of old internal conflicts. The concepts of resistance, displacement, and rejection are also used in reference to transference. The major significance of transference is the insight it gives into client feelings and behaviors toward persons important to them outside of pastoral counseling. If clients can be helped to see how their reactions to their pastoral counselors are caused by a confusion of those pastoral counselors with other persons, the inappropriateness of similar reactions outside of counseling becomes more obvious. If a client projects the childhood image of a father or mother onto the counselor, the client may be doing the same to other individuals, such as professors or employers. When clients express irrational feelings of transference toward their pastoral counselors, knowledgeable pastoral counselors inquire into the possibility that such feelings have a history. They may say, "Have you ever felt this way before towards any other person?" One sign of a pastoral counselor's self-confidence and maturity is the ability to acknowledge when a client's perceptions are correct and to accept as genuine those feelings based on correct perceptions. Pastoral counselors try to understand and accept transference. Acceptance then leads to the recognition by clients that these feelings are within themselves and not in their pastoral counselors. In addition to simple acceptance, a number of other responses for working through and preventing a deep transference are helpful. The pastoral counselor asks clarifying questions regarding the forms of anxiety which the client seems to be manifesting through transference. The transference feeling in the client's statement calls for pastoral counselor reflection. The minister may give direct interpretation of the transference feelings. Focusing on what is occurring rather than why it occurs provides a more fruitful technique for handling difficult transference problems. In general, pastoral counselors call attention only to negative transference feelings because focusing on transference causes clients to react in the opposite manner. Pastoral counselors do not call attention to positive transference unless it reaches a level where it interferes with counseling. Pastoral counselors should always consult with their supervisors when transference becomes unmanageable. Lastly, pastoral counselors may refer clients to therapists qualified to give more extensive psychotherapy if situations develop to an intensity that is beyond the competence of the pastoral counselor. Although transference provides insight into the client, transference is not the relationship. Relationship has to do with the real, rational, appropriate, and earned interactions within the counseling situation. If pastoral counselors present themselves as genuine persons in counseling and act accordingly, they are usually able to focus on relationship in counseling rather than worrying about uncontrollable transference. Learning to manage transference should be done under the supervision of a highly trained and experienced pastoral counselor. The situation is reversed in the case of countertransference, which has been defined as when the second person's reaction to the first person in the same relationship is also influenced by his former relationship patterns to significant persons rather than the stimuli in the present context. He is involved in countertransference. Because countertransference is an unconscious phenomenon, countertransference is difficult for pastoral counselors to detect. There are a variety of signs of countertransference. Some attitudes or feelings the pastoral counselor may experience include anticipating or dreading a counseling hour, being bored, drowsy, or inattentive during counseling, over-identifying with a client, resenting or feeling jealous toward a client. Pastoral counselors do well to concentrate on relationship. Countertransference is best avoided where possible. Once pastoral counselors can recognize countertransference with some level of accuracy, they need not fear it. Acknowledge the countertransference with a colleague or supervisor, and discuss strategies to appropriately manage countertransference.